and familiar with. And so this can really enhance communication. It can help them open up more, especially when we start to talk about, doing virtual visits for like mental health disorders or just some other things that people might not be too comfortable to talk about maybe when they're in the hospital. What are some of the advantages for providers? Same thing, improved access to healthcare services. You're able to manage a larger patient caseload because, when you are able to see a dashboard that has a lot of health information about a lot of patients all on one screen, you're able to make decisions for so many patients, which is way more kind of efficient than going into each patient's room when the patients are in the hospital. But when they're at home and you're able to see all of that information on one screen, you're able to make decisions for a lot of patients all at once. There's also a reduce in no-show rates because the scheduling is flexible for the patients. And so patients don't have to worry about transportation. And so it really minimizes the no-show rates because patients are more likely to attend the appointment if they don't have to worry about traveling and driving, especially if they live really far from healthcare facilities. There's enhanced job satisfaction because the services are very there's flexibility in how we deliver healthcare services. So whether it's in person or virtually, there's some providers really, really enjoy that flexibility. And then improved efficiency, again, with streamlined workflows, the providers are able to really efficiently take care of patients virtually. Some benefits for the healthcare system, improved quality metrics. So some of those hospital-associated complications, for example, patients who get hospitalized for a long time can develop like wounds and pressure ulcers and some hospital-acquired infections. They can develop delirium and confusion. So these are things that by keeping patients at home, we can prevent, and therefore the quality metrics can improve. There's also more patient satisfaction and decreased in readmissions because if we're able to monitor patients at home, intervene early if they're starting to deteriorate, we can actually prevent an emergency department visit or even a readmission to the hospital. There's improved hospital or clinic throughput, meaning from the time a patient enters the doors of a clinic or hospital to the time they exit, there's improved flow of patients because we're not keeping patients in the hospital or the clinic if they don't need to be there. So we discharge them, they go home, we can take care of them from home, which also decreases cost of care and overhead costs for the healthcare system, and then increases access to care, as we've previously discussed, and then improved patient outcomes because we're able to monitor patients at home for a little bit longer than maybe we may have monitored them in the hospital, and we can catch things early and intervene before they deteriorate a little bit more. What are some of the challenges in implementation of virtual hospitals? Some of these are, again, just examples of challenges. So regulatory hurdles are huge. For instance, in the US, if you are doing virtual care from one state and trying to interact virtually with the patient in another state, you might need to get licensing for that different state. And so you will find that most virtual care organizations or virtual hospitals have a lot of licenses from multiple states because of that. And so that can really be a hurdle. And then reimbursement policies. So again, trying to get reimbursed for these visits that we do has been a little bit of a hurdle. Things are getting better now, but it wasn't always kind of, easy to ask to be reimbursed. Just the policies are always changing around that. And then we always worry about data privacy, right? We do the best we can to keep patient information private, which we do. We have the right safeguards in place and guardrails, but you know that's something that you just worry in the back of your mind about potentially compromising the privacy of the data when you're dealing with things virtually. And then technology access disparities and infrastructure. So as previously mentioned, for patients who are in rural or remote areas, they might not have the devices or the broadband Wi-Fi capabilities to do virtual care. And so you will find some disparities there. And so what we've done, including the area that I practice, is if a patient doesn't have a smartphone or broadband and Wi-Fi, then we end up just doing a telephone call to check up on them and see how they're doing. That most times is better than nothing. And then staff training and care coordination, you guys are doing the right thing because you're starting to talk about this during kind of the early stages of your career. But that can be a challenge as healthcare evolves into this more kind of hybrid model of virtual and physical care. We have to keep up with the training, and that can sometimes be a challenge. Digital literacy of patients. So those elderly patients, the ones who are maybe hard of hearing or poor vision, or just don't have the technology literacy level, will likely not be too excited about doing virtual visits. But we've actually had pretty fair luck with those patients. We've been surprised at times where you would think maybe a patient might not be interested in trialing a virtual visit or appointment, and they actually end up trying it and loving it. So, but these are just things to consider when implementing a virtual model of care. So no one can really, I mean, this is a complete guess of what the future of virtual hospitals looks like, because things are changing so fast. And so, we might be thinking of things changing maybe 5 years from now, but I feel like every couple of months or so, there's like a new development within the virtual hospital space. So we're definitely going to keep seeing regulatory evolution. So I think maybe these regulations are going to be a little bit more laxed and more kind of flexible around cross-border, virtual visits across different borderlines, and maybe make that process a little bit less, a little bit more, flexible and remove more barriers so that people are able to do this better. And we're going to continue to see technological advancements. There's, we have new devices popping up every few weeks, I feel like. So that's not going to slow down anytime soon. Neither is AI or automation integration going to slow down. So we're going to see a lot of patients being able to just log in to their online accounts and being able to start a chat, and being able to be triaged to the right person. We're going to be seeing some early detection of any abnormalities that are detected through remote patient monitoring. And that's a good thing because we can intervene and we can improve health outcomes. We're going to see hybrid care models, so physical combined with virtual spaces to provide care to patients. We're going to see ongoing expansion of telehealth services, especially mental health. There's a huge need for mental health services in this country, and they're really, really trying to leverage the virtual hospital space to be able to reach more patients for this needed service. We're going to see expansion of ICUs, and so really kind of the example I gave with the ICU, the EICU nurses dialing into a patient's room and helping the bedside nurse. We're going to see kind of more of that, providers who are, trained in emergency medicine or intensive care units be able to offer their skill sets and services to maybe areas where there is not as much, maybe there's like maybe a lack of or reduced access to those types of skill sets. And then we probably see some robotics helping with procedures, and whether that's in the operating room or in just different settings. I think there's so much more opportunities there for robotics in terms of how we do procedures or how we provide care in general. And then workforce evolution. Again, you guys are already talking about this and getting this in your curriculum and early on in your careers. But there's going to be ongoing training so that we can keep up with all of the changes that are happening in the virtual ecosystem. And then flexible staffing models. I think more people are going to be able to work from home, providing care, because you can again do this remotely, and that's a satisfier for most people, having those flexible staffing models. So that's a very good thing. So I only have one reference when we talked about Mayo Clinic and the number of staff members we have and how many digital appointments we were able to do last year. I just included that reference here, so you can take a look at some of the other numbers that came from that fact sheet that I took those stats from. And I think that's all I have. Well, thank you again so much for the opportunity to present on this topic, and I look forward to answering any questions you all may have. Thank you.